Normal composition of CSF. The appearance of CSF will be clear, colorless, odorless fluid. The presence of lymphocytes, it will be less than 5 mm per cube. Polymorphs, it will be absent in normal CSF. The pH value of CSF is 7.4. Total volume of CSF is 100 to 150 ml. The daily secretion of CSF is 450 to 500 ml. The specific gravity of CSF, that is 1.006 to 1.007. It is important. Protein value, that is 0.15 to 0.45 gram per dl. Otherwise we can say 15 to 45 mg per dl. The glucose value of CSF 50 to 80 mg per dl. Otherwise we can say 2.8 to 4 millimole per liter. The chloride value of CSF, that is 115 to 130 millimole per liter. Calcium 1 to 1.4. Phosphorus 0.4 to 0.7. Magnesium, that is 1.2 to 1.5. Potassium 2.6 to 3. One more thing, important thing, that is normal CSF pressure, that is 5 to 15 centimeter of water. And according to the book, it may vary, but it may extend to 20 centimeter of water. Okay, the middle value, peak value we are usually taken, that is 50. So the normal CSF pressure, that is 5 to 15 centimeter of water. So the important point that you have to remember in normal composition of CSF, the appearance, clear, colorless, odorless fluid, pH value, that is 7.4, specific gravity, that is 1.006 to 1.007, then protein value, that is 15 to 45 mg per dl, then glucose, that is 50 to 80 mg per dl. Then based on the values, the variation in the values, we are diagnosing the different conditions of the CSF. Okay, so especially the meningitis, bacterial meningitis, viral meningitis, then other disorders, it can be identified by the CSF analysis. So we can see the what is the differentiation between all this disease. The diagnosis of the cerebral spinal fluid analysis. In the diagnosis, in case of bacterial meningitis, the WBC count will be more than 1000. Normally the WBC count, it will be 0 to 5. Usually it will not be there, and when we are assessing, sometimes we will get 0 to 5. Bacterial meningitis, it will be more than 1000, that is greater than 1000. The glucose value, it will be less than 40. The protein value, it will be more than 250. So in bacterial meningitis, what you have to remember is WBC count will be elevated, glucose level will be decreased, protein level will be increased. But in case of tuberculosis meningitis, the WBC count, it will be 5 to 1000. Glucose value, that is less than 10. Then protein value, that is more than 250. In case of viral meningitis, the WBC count, that is from 100 to 1000. Glucose value, that will be normal, 40 to 70, between 40 to 70. Protein value, that will be less than 100. So viral meningitis we can easily identify, that is the glucose value that will be within normal limits, and the WBC count, that is from 100 to 1000. The protein value also, it will be less than 100, not less than 40, it is less than 100. In case of Guillain-Barré, The WBC count, that is 0 to 5, it will be within normal limits. Glucose value, that also within normal limits, 40 to 70. But in case of protein value will be 45 to 1000. So, based on the variation in the values, we are diagnosing the conditions. So, this is the differentiation between different CSF values and the disease conditions. Thank you.